Good afternoon, everyone. I'm Laura Cepeda. I'm the Chief Medical Officer with the Mobile County Health Department, and I will begin your Facebook Live update today. Dr. Murphy isn't here. I know there'll be a lot of disappointed folks today, but I will start with the COVID update with around the world. Today, the reported number is 15,594,551 cases, with 635,086 reported deaths. In the United States, there are 4,073,243 reported cases and 144,780 reported deaths. In Alabama today, we are reporting 74,365 cases and 1,395 deaths. So I know yesterday there was some confusion about the reporting, and there were some misreporting, some things that were negative, and they were doing a recount. So today we are reporting 6,972 Mobile County residents that have been diagnosed with COVID-19. And the number initially reported on July 22nd that had the error in processing the lab reports has been corrected, and the final number for yesterday has been adjusted to 264. So that was still our largest one-day total by far, actually, and today is our second highest number as well. So 211 is our new cases for today that have been reported. So yesterday our final number is 264, today is 211, and these are our two highest days that we have reported so far throughout our reporting on COVID-19 in Mobile County. Today we're reporting 177 COVID deaths, which actually represents a decrease of one. And just like we saw, the numbers can change with the reporting from yesterday with the cases. I say it represents a decrease of one because that case was actually reassigned to that person's home county. And as we know, our hospitals in Mobile have patients that come from all over, not just from within Mobile County. So what most likely happened was that we had someone pass in our hospital, but they actually weren't a Mobile County resident, and so that case was reassigned to their home county. So that's how they can be a case in our recorded in our system and then leave our system. So I know as it's happening in real time, it is a little confusing, but y'all are seeing it happen in real time. So today we have between 180 and 190 patients with COVID disease in the hospitals in Mobile County. So we have some questions from Facebook viewers and from the media. I think that there is a lot of confusion still about the change that's come out from the CDC in terms of the timing. That's the 10 days plus 24 hours if you have tested positive versus the 14 days if you've been exposed. So the first question is, if you've been exposed, you should quarantine for 14 days. And if you develop symptoms during that 14 days, you should quarantine an additional 10 days and can quit quarantine after 24 hours without symptoms, but you should not get tested. How are you counting those cases that don't get tests? So I think that's a misunderstanding of another one of the changes of the CDC guidelines, which is that now partly because of to keep the test kits just for cases that are new. It's one of the new guidelines. Don't get tested again for 3 months after you get tested, because we know that sometimes people are still having a positive test result even if they're out of their infectious period. So if you are quarantining during your 14-day quarantine period and you start to get fever or shortness of breath or any symptoms that indicate that you probably have become infected with COVID, you can get tested for COVID. And if you test positive, you are then counted as a case. Just one time. You don't need to get tested again. If you are out of work, you would then, begin that new 10-day period. No fewer than 10 further days would you need to be on isolation then. And if you at 10 days were fever-free and symptom-free for 24 hours, then you could go back to work and resume your normal activities. But you would not need to get retested to have a negative test. There used to be some guidelines that you could either use a time-based or a test-based strategy for return to work or normal activities. And the CDC has removed those test-based strategy guidelines. So that's where the testing, I think, confusion has partly come into play. So hopefully that clears that up. But in terms of counting the tests, your positive test is only counted one time. Even people who used to get more than one test, even if it was positive, it was only counted one time. Okay, question about schools. For private schools that are opening mid-August, will the teachers and children be required to wear a mask? So that depends. That's not helpful maybe, but if the governor extends the mask order that's currently in place in Alabama beyond the end of the month, then yes, everyone would be required to comply with the governor's order, assuming that it went beyond the start of school date. So if not, and if that order expires at the end of this month, then it's up to the individual schools what they have, the teachers and students and everyone that on their campus do. So that depends what happens, and that order is set to expire on July 31st. So we'll probably hear something pretty soon in terms of what the governor's plan with that is. So if not, it's up to individual school. More on schools about fall sports from a medical standpoint. Can you comment on fall sports in schools? So, that's a big question, and fall sports aren't all the same, and I think that is the big thing is, the next question is, should they all be held or all be canceled? And every single one of them is different. Some of them are outside, some of them are inside, and they all carry different amounts of risk. Certainly, the participants are different ages, and all those things factor into the risk that goes along with them. So what we do know about COVID-19 and children is that thankfully otherwise healthy children, especially the younger school-age kids, tend to do pretty well in terms of severe outcomes even if they're infected. So under 10 years old, kids do pretty well even if they're infected. So that age group probably wouldn't have too much of a problem playing sports in the fall. But what factors into that is the risk that comes along with everything else. Who's attending the games. So you have the parents, you have the coaches, and you have everything else. And what we do know is that the people who are most at risk that we've seen have severe outcomes, including death from COVID-19, is people over 65. So, if there are all sorts of scenarios you could consider to maintain sports in the fall. NASCAR had races with no spectators. You could talk about doing something on that level if you wanted to, take out some of the risk. Or again, it's all about risk stratifying. I think keeping everything the same as it's ever been carries a lot of risk. You can talk about having spectators and having them wear masks. You can talk about distancing in stands if you want to have spectators. I think the thing that would be a big mistake is to carry on like we always have without realizing that this is not a sports season like we've ever had before. Nevada, Washington, and California just are the latest to flip their seasons in terms of going to, I think, a spring football season. Texas, Florida, Oregon, and Georgia have delayed their football season. So, I mean, other places are doing this, and it's a conversation that needs to be had, and all these things taken into account, because what we do know is it's not the children typically who have the bad outcomes, and so they are the ones that are out on the field, but they aren't necessarily the ones at risk in this scenario. So all those things really have to be considered, and everything that can be done to minimize the risk to the people involved, I think, should be. So those things are conversations that need to be ongoing, depending on the level of case positivity in the community. When months ago, when the president was talking about reopening, he would talk about numbers like 3% and 5% positivity. Now Mobile County has about 20% positivity for our test rates. So, those numbers are a lot higher than that 3 to 5%, indicating that we still have a lot of widespread community transmission ongoing. So, there's a lot of disease out there. So all those things I think you have to take into account when you talk about sports and schools, and just be aware that there's risk in everything that we do. Certainly there's risk in letting your kids play sports, but typically you think of the kids being the ones taking the risk, not the spectators in the stands. So it's just we have to think about it all very differently this year, and realize that it's a whole new game, and we have to think about it and play it differently. So, another question: do we recommend wearing form of goggles with glasses and over regular glasses? So that depends on really the environment that you are in. In a medical environment, absolutely. If you know that you're going to be exposed to any sort of aerosol, or if you think that there's any reason to think that you're going to have any sort of exposure, absolutely. You'll see a lot of face shields out there and on the market. They do not substitute for a mask or face covering. There have been some good studies that show that when people have worn them in place of a mask or face covering, that they are inferior, actually. So I would not recommend them in place of, but simple glasses or goggles do a lot to protect your eyes if you are concerned that you're in a high-risk environment. They're not recommended routinely, but certainly if you are concerned that you might be in an exposure environment, absolutely. Okay, what are your views on the reported vitamin D deficiency in COVID patients, and theories that the vitamin may help people recover or possibly prevent it? So vitamin D is is one of the things that we need to function on a basic level. And as as a dermatologist, that's near and dear to me. We get it on a daily basis through our skin when we're out in the sun. Certainly people who are at risk for low levels of vitamin D are the elderly who don't get any sun exposure. And we also know that those over 65 are the people who have been dying of COVID-19. In terms of the the data for COVID-19 and vitamin D, the studies that I've seen about this have not actually been compelling. What I've seen is they've used historical data about vitamin D deficiency in countries that have had compared their vitamin D levels to their COVID deaths, not in terms of their an actual vitamin D level in a COVID patient who died. So that's not terribly compelling or helpful to me. I mean, I understand that yes, people who are elderly are more susceptible to COVID-19. People who are elderly also are not getting out and getting much natural vitamin D. But what I've seen in terms of good data about vitamin D and COVID-19 has not been anything that's impressed me in terms of the studies. That being said, vitamin D supplementation is widely available. We live in the very sunny South, and most of us get it walking to our car and back, but it's available in many forms for supplementation as a concern. You don't want, as with anything, you don't want to overdose on it because that's a risk. So moderation is key, but I haven't seen anything compelling to this point. So just to reminder for everyone that we do need to still get kids in for their vaccines before school starts. Even kids who are doing virtual school through the Mobile County Public Schools need to get all their vaccines updated before they can register. You can do that through your regular doctor, or if you don't have one, we'll be happy to accommodate you through the Mobile County Health Department. The number is 251-690-8889. And we can provide you a copy of your blue card if that's all you need as well. But numbers for children's vaccinations dropped dramatically throughout Alabama, over 50% from March to May, just as people were afraid to go seek routine care. So the last thing that we want and need is to have an outbreak of vaccine preventable disease during a pandemic. So please make your appointments for your children to get their routine checkups and get their vaccines up to date so that they can be back in for whatever method of school they'll be going to in a month or two. And I think, there's one other thing, sorry. So there's a question we had about, it's a version of something we've gotten several times, and it was about wave transit and if there's been an infection on that. And what it comes down to is if there is an infected employee, are they required to report to us, and then would they be required to report to their coworkers? And what it comes down to is that we receive reports of all of the cases. In terms of whether an employer is required to report to other employees, they're not. That's protected health information. That's a HIPAA violation. However, any employee who has been in that contact and who's an exposure to whoever the infected person is will be notified. So if you have been exposed to anyone, whether it's through work or any other form of contact, you'll be notified, okay? So you don't need to be worried that you might have been exposed. If you have been, you'll be notified, and that your employer isn't contacted. They don't need to know, because again, that's protected health information of that person. And it would be if it were you too, so you don't need to be worried. So you would be contacted if you were exposed, regardless of whether it was at work or through any other means. So I think that's everything I have for today. Now, we've got one other speaker, Melissa Creighton, is going to come finish up for today. Thank you, everybody. Have a great weekend.
Thank you, Dr. Cepeda, for that report, and we appreciate everyone tuning in. My name is Melissa Creighton Bryan. I am the grants manager for the Mobile County Health Department. Today is an official dress down day for the Mobile County Health Department. You may or may not be able to see that we are wearing our PrEP dress down t-shirts to spread awareness and education. The U.S. Department of Health and Human Services, HHS, awarded the Mobile County Health Department's Family Health Division with the Ending the HIV Epidemic grant funds, and we are actively using these funds to purchase materials for patient education purposes regarding PrEP. So what is PrEP? PrEP is pre-exposure prophylaxis. It's a daily medicine that is highly effective when taken appropriately to reduce your chances of getting HIV. So PrEP can stop HIV from taking hold in spreading throughout your body. So as always, note that condoms in conjunction with other safer sex practices can protect you against other STDs like syphilis and gonorrhea. To find out if PrEP is right for you, please visit your healthcare provider. Ready Set PrEP is a nationwide program that is led by the HHS that provides PrEP medications at no cost to thousands of individuals who qualify. So to check your eligibility and to enroll in this program, you can visit www.hiv.gov and you can just search Ready Set PrEP, or you can contact your case manager. Today we had our Love Me Luau Wellness virtual Facebook presentation, which went great. It is available on our Facebook page so that you can view that at your leisure. It's also available on our YouTube page. So we are excited about all the things taking place at the Mobile County Health Department, and we look forward to serving you. And if you have any questions, please feel free to direct them. As always, if you need to schedule an appointment, as Dr. Cepeda said, 251-690-8889. Thank you so much.